Thank you, Tracy. So I know that we are being recorded, so some of you may not feel comfortable asking questions, but this is more of a very informative presentation today so that you get your questions answered and know what the expectations are if you do choose to pursue counseling. So please feel free if you would like to put questions in the chat. We don't have to read names during the recording. So we are going to talk about finding the right therapist for you. And I am a licensed psychologist and have been in private practice. I now work for BayCare as one of the behavioral health directors and also the director of our assistance programs. So, in finding the right therapist, it's important because therapy is really going to be most effective when there is a good fit between the therapist and the client. The therapeutic relationship should be experienced as authentic and trustworthy. Now, I do want to caution people in finding the right therapist that if you do go to an initial appointment with a therapist and it doesn't feel comfortable for you, to really examine why. What is happening here? Is it because you're uncomfortable with the whole therapeutic situation, or is it really something about the therapist? And I often encourage people to consider at least 2 sessions before deciding whether it's the right fit for you or not. So I start off by encouraging everyone to think about what your goals are in therapy. Knowing what you want and need from therapy can help narrow the search for the right match or fit for you. So some of the questions to ask yourself is, what do you want to achieve by attending therapy? So for example, if your goal is just to deal with basic stress, that's going to be a different therapist than if you have trauma in your background and you really want to deal with that trauma. Another question is, do you think you will be able to accomplish your goals in a short-term model or more of a long-term model? So is it something brief that you want to address? Or is it something that you think would be long-term? Or do you have maybe a goal that you want to achieve right now, but then have other goals after that for other things that you would like to work on? So really sit back and think about what is it that you want to get out of it. And finally, do you have a type of therapy in mind that will help you achieve your goals? We are going to talk about different types of therapy. There's so many different types, so we're not going to do an exclusive list, but we are going to talk about some of the most common ones. So you can think through some of those and decide, what type of therapy you might want. Most therapists do use kind of a mix of different types of therapy, but there are some that are very specialized. So know what your comfort level is in choosing the right therapist for you. So, in other words, do you feel more comfortable speaking with a male or a female? And that can be related to just your comfort level. It can be related to what's happened to you in the past. There's all kinds of different things, experiences that can feed into what you feel most comfortable with. And maybe it doesn't matter to you, and that's great as well. Do you want to meet in person or would you prefer to do telehealth? And that might be number one, a comfort level, or it may be a time issue. So if you have a demanding schedule and driving to a therapist's office just isn't going to fit into your schedule, then I encourage you to try the telehealth options. And there are a lot more flexible options when it comes to telehealth as well. Um, Now, I put this next one up there. Is there any discomfort if someone is younger or if they're older? And the reason I do that is because it's not uncommon for individuals to request a therapist, then go to the therapist and say, oh my gosh, the therapist is just too young for me, or that therapist is too old for me. So, really ask yourself if you have any discomfort with the age as well. Again, we talked about the specific kind of therapy. And then would I feel better if someone recommended this therapist? So would you feel better getting a therapy recommendation from someone you know, someone that's in therapy, or another provider, or some professional in the community? Or would you prefer to just go ahead and research that therapist or different therapists? And do I prefer someone from my own cultural background? And this is a big one as well. If you are not primarily English speaking, maybe you prefer someone that speaks Spanish, or someone that understands your culture. consider those questions when you decide what you're comfortable with. Another one is to check out the qualifications and decide what qualifications you want. So there's, again, different qualifications when it comes to levels of training, specialty areas, things like that. What you see most common out in the community nowadays is the master's level therapist, although there are psychologists as well, which are doctoral level. So the training is going to be more intense. But what we see more of in the community are our licensed clinical social workers, which would be LCSW next to their name, licensed mental health counselor, which would have an LMHC next to their name, and a licensed marriage and family therapist, which would have an LMFT next to their name. When we look at the doctoral levels, we can look at two different ones. There's PhD or a PsyD. Both of them are qualified psychologists. They still have to pass the same national licensing exam and state exams as well. But a PsyD program is more geared toward actual practice. So somebody who really wants to be in practice, seeing clients as opposed to research based. Although some of the PsyD programs do have a lot of research as well. So you want to look into your therapist's credentials. If it's important to you, check their professional affiliations. Are they affiliated with the American Psychological Association, or are they affiliated with the Social Work Board, or whatever it is that you might find important? Experience might be another thing that you want to consider. Do you want somebody who's relatively new and might be up to date on the new types of therapies, or would you prefer to have someone who's been doing this for a long time and maybe not as aware of those new types of therapies? And then, of course, we already talked about checking the degree, and the specialty area is important as well. If you have a particular area that you are working on, it's important to seek someone who has those specialty areas. Again, I bring up trauma as one of them. But if you're dealing with depression and anxiety, most therapists should be able to handle that. Another consideration would be insurance and finances. So again, some questions to ask yourself. How do I plan to pay for my therapy? Do you have benefits within your insurances? If you do have an EAP, an employee assistance program, which I believe you all do, definitely start there because you get your free sessions depending on the type of program that you have. And then you can continue with that therapist, hopefully with the insurance, if you'd like to continue past whatever amount of sessions your company pays for. And always ask that question up front. If you do go through the EAP initially, you're going to give them the qualifications of what you're looking for, the answer to those questions that I just showed you and talked to you about. And then they will give you a list. You can do your own your own research on that and decide who you feel comfortable with. And then when you call that therapist, please ask if they take your insurance in case you would like to continue past the employee assistance program sessions. Um, if you are using insurance, please ask about your copay. And then again, considering whether you feel you need short-term based therapy or longer-term based therapy. Because again, if you do want longer term, you want to make sure that not only can you use your EAP sessions, but you also can then continue with that same therapist with your insurance. Okay, so I did say that we would talk about some different types of therapy. Again, this is not an exhaustive list. This is a just the most common ones that you're going to see out there. And you can think about, like, do any of these really resonate with you? So let's go through some of them. So your psychoanalytic and psychodynamic therapies, not a lot of people do psychoanalysis anymore, but that was the old Freudian therapy. But psychodynamic is the more common one now, and that's focused on changing problematic behaviors, feelings, and thoughts by discovering their unconscious meanings and motivations to you. So in other words, you're going to really take a look back at where's this coming from on an unconscious level. The next on the list is your cognitive behavioral therapy, which is very common, and we call it CBT. And this is a short-term form of psychotherapy that's based on the idea that the way that we think and feel affects the way we behave. So goals of treatment, the goal of this type of treatment is to help clients you all to identify, challenge, and change any maladaptive thought patterns in order to change their responses, your responses to difficult situations. So if you are thinking, for example, in black or white or more narrow based, this helps with more rational beliefs and thinking and cognitive processes. Another very common one nowadays is the dialectical behavioral therapy, or DBT. And this is a structured program of psychotherapy with a strong educational component. It's designed to provide skills for managing intense emotions and negotiating relationships, social relationships. It usually consists of a group of instructions as well as individual therapy sessions, and it can last about 6 months to a year, depending. Hypnotherapy, please make sure if you do choose to do hypnotherapy that you do it with a trained therapist who has had training in hypnotherapy. And this is using guided hypnosis to help a client reach what we call translate state of focus, but it's more of an intense, a focused state of attention and concentration. And, for example, when you drive a car and you don't remember the drive, or you're watching a show on TV that you're into and someone's talking to you and you can hear them talking to you, but you're not paying attention to them. That's that focused state of attention. Excuse me. Um, so you have the awareness of what's going on around you, but you're really focused. So it's like being completely absorbed in a book or movie or something like that. Um, a trained clinical hypnotherapist can help you in that relaxed state, turn your attention inward and discover resources within yourself that can help you achieve your changes, whether they're behavior changes or maybe you're trying to manage pain or other issues like that. So you learn how to address this on your own, and you eventually will learn to be able to do it on your own as well, which gives you more control over your responses. There are many different types of trauma therapy, and we will go over some of the more common ones in the next slide. But trauma therapy really does specialize in dealing with past trauma. And in order to deal with past trauma, you will have experienced a life threatening event or a perceived life threatening event. So I tell people this all the time. You don't have to necessarily have been in a life threatening event yourself to have a trauma response. It can feel like it was life threatening, or you could have witnessed it, but you do not have to have experienced it directly. Marriage and family or couples therapy addresses the behaviors of all family members and the way these behaviors affect not only the individual family members, but also the overall relationship as a whole. And then finally, what we see a lot of nowadays is the solution focused brief therapy, and this is very widely used. And this type of therapy focuses on finding solutions in the present and exploring your hope for the future in order to find a quick and pragmatic resolution of the problem that you're dealing with, or problems. Takes the approach that you know what you need to do to improve your own life, and with the appropriate coaching and questioning, you are capable of finding the solution for you, the best solution. Okay, I did say we would talk about some of the trauma therapies. So these are the more common ones. Again, there is a very long list of different types of trauma therapies, but these are the ones that we're going to see more commonly. The first one being cognitive processing therapy, or CPT. And this is a specific type of cognitive behavioral therapy, as I talked about prior, and it is found to be effective in treating trauma, such as post-traumatic stress disorder. It is short term. It is typically conducted over a course of 12 sessions, and the focus is on challenging maladaptive or self-blaming thoughts that may be exacerbating the symptoms that a person is experiencing, as well as anxiety and depression that are not uncommon when someone has experienced some kind of trauma. Eye movement desensitization and reprocessing therapy, or EMDR, is a very common one used nowadays as well. And again, you have to have specialized training for this. And this is the use of eye movement, and it's designed to relieve the distress associated with disturbing memories. So what it involves is recalling a specific troublesome experience while following a side-to-side visual stimulus delivered by the therapist. And that resulting lateral eye movement is thought to help reduce the emotional charge of the memory so that the experience can be safely discussed. Um, it does help strip the power that of that memory that triggers the anxiety and avoidance, which is very common with trauma. The next one is ACT, or acceptance and commitment therapy. And this is a very action oriented approach to psychotherapy that stems from traditional behavioral therapy and cognitive behavioral therapy, as I talked about earlier, where you as the client would learn to stop avoiding, denying, and struggling with the inner emotions and instead accept that deeper feelings are an appropriate response to certain situations that should not prevent you from moving forward in your lives. With this understanding, you can begin to accept that this has happened and commit to making changes in behavior. So regardless of what is going on now in their life, in your life, and how you feel about it. So in other words, it's really accepting that this trauma has happened and that having intense feelings and emotions is very normal. And then being able to kind of move forward from there. Prolonged exposure therapy or PE is common. This is typically provided over a period of about 3 months with weekly individual sessions. And it's a type of cognitive behavioral therapy as well that teaches people, individuals, to gradually approach trauma related memories, feelings, and situations. So it's a gradually approaching those trauma memories. So a lot of times people avoid them. When I will warn you, if you do have a history of trauma and you're avoiding dealing with the emotions and the memories, you are going to get worse. You're going to feel worse. And finally, we're going to finish up with the ART, or accelerated resolution therapy, which guides the client to replace negative images in the mind that cause the trauma symptoms with positive images that you get to choose yourself. It's often done very quickly, 1 to 3 sessions, and it works directly to reprogram the way in which the distressing memories and images are stored in the brain so that they no longer trigger those really strong physical and emotional responses. I'm going to finish up with where do you start, and then we'll talk briefly about what to expect. Okay, so the best place for you all to start is an employee assistance program if you can, to start there, because they will help you narrow down and answer those questions that I asked you to find the right fit for you. Obviously, insurance is important if you do want to continue past those sessions. It always helps to have a family or friend referral. If you know somebody who did have a successful experience, it's often helpful to find out who that was. And then finally, Psychology Today, in that website that I have listed up there, really does have a whole list of therapists, and almost all therapists are in their directory there. And it tells you a little bit about each therapist. So that's that www.psychologytoday.com/us/therapists. So make sure that you do your research if you're able to. Look up whatever therapist you're considering online, because you'll know whether that feels right to you. And again, you can go with a feeling. Check out their website. Does it fit for you? Pay attention to what your gut tells you. And if you go to your first appointment again and feel it's just not a good match, like I said in the beginning, just ask yourself why. Could it be fear? We're all not comfortable with having to open up our emotions, right? So we want to make sure that it's not just fear. So when someone comes and they've tried 3 or 4 different therapists and none of them seem to be a good fit, then that's often because they're afraid of something. So ask yourself that. And it is okay to let the therapist know if it is not a good match for you. And then you can try again to find the right match. And they may even have a recommendation. And what to expect in your first session is they're going to ask you a lot of questions to get some background, to understand your background. And they're going to ask you some of the questions that I put up on the slides here today. What are your goals? What do you want to achieve? Are you looking for something in particular? So, that being said, does anyone have any particular questions that they'd like me to answer?